much. I mean, I thank Intus for sort of organizing this sort of series, which I thought that after 30 years, I mean, when you are more near to your end than the beginning, uh, it's time you, impart some of your experience, more your failures than success with others who are going to come up in this field. Uh, to me, hematopoietic cell transplantation, as I like to call it now, is a religion, or something more than a religion, you can say. I started this journey as long back as in 1991. Although my initial craze was hematology, it was my first guru in transplantation, as you can call it, was Professor Kripal Singh Chugh in PGI Chandigarh, where I did my MD medicine. He was a father of nephrology and, kidney transplantation in our country. And my interactions with him actually raised my interest in transplant immunology to a large extent. So my interest in transplantation comes from the fact that the biology behind solid organ transplantation intrigued me. And I had seen how Professor Chugh approached the whole discipline. And subsequently, when PGI Chandigarh had brilliant all departments, but did not have sort of clinical hematology discipline as such at that time. So I went to the only place where in 1993 people could go for hematology, which was Christian Medical College, Vellore. And as you know that today is the Teachers' Day, and I did not plan it to happen on a Teachers' Day, but it so happens that it is Teachers' Day today. And I get this opportunity to salute all the greats in this field who have contributed, who have taught me, who have mentored me directly or indirectly. And one such person, when I went to Christian Medical College, Vellore, was Dr. David Dennison. I know that a lot of you sitting here in India today would not know about him. But in those early days, when they had restarted their transplant program after Dr. Dennison returned from US, there were more failures than success. And I would see this gentleman sit in the hospital, in the wards from early morning to late at night, taking care of patients, preparing protocols, analyzing data. He was always there. And that is where I first saw his book. That is what I considered my Bible, or Gita, or Quran subsequently, which is Thomas's textbook of hematopoietic cell transplantation. It was his textbook which he gave to the department. And I used to sit there every evening or night and read that book. People who do transplantation nowadays think that it is an offshoot of hematology. But what I've learned over 30 years that the diseases we treat are mostly related to hematology or oncology, for example. But this discipline has very little to do with hematology. The discipline or the biology of hematopoietic cell transplantation is pivoted on immunology, and immunology. And what you need along with that is a very solid knowledge of medicine, pharmacology, and infectious diseases, amongst the rest. You might be a brilliant hematologist in treating chronic myeloid leukemia with 5 different TKIs, or CLL with many of the newer drugs. That doesn't make you a hematologist. That does not make you a transplanter. So saying that, when I came back to India in 2010, I started doing a very different sort of transplant, as many of you would know, which is a haploidentical transplantation. And I had only two students in my life. In my entire 30 years career, I had only two students who I mention of or who I talk about. One is now what you people refer to as Professor Pankaj Malhotra, who is head of hematology in PGI EMEA Chandigarh. So when I started the department of clinical hematology from being a part of medicine, as something to stand on its own, Pankaj was there as a junior and then a senior resident. And his keenness to learn, his keenness to participate, and he was always there with me, whether it was patient care, whether it was analyzing data, teaching me how to use a computer. Those days there were no computers, mind you, in every household. So I learned a lot of how to use a keypad from him. And subsequently, when I left PGI Chandigarh, he became the assistant professor over there, and subsequently he heads the department now. And surprisingly, he still remembers me. And the other person who after I came back to India, the only person who could, have the sort of dedication, sincerity, and honesty which I was looking for always. Believe me, in my 14 years in the UK, almost 14 years in the UK, I did not find a single student who I could call a transplanter who would actually have a legacy of myself, which I actually inherited from a lot of other people. So a lot of people ran away when I started the transplant program at Apollo Kolkata. A lot of them are now doing DM oncology, past DM oncology, but they ran away from transplantation because the rigor of it was too much, or my intensity was too much for them. The only person who could withstand my, kharooshness, as you can call it, and love the discipline, for practice the discipline with that sincerity and honesty, was Dr. Sarita Jaiswal, who still happens to be with me. That is her misfortune. You can come on the screen, you can just raise your hand and say who you are. Can you just raise a hand, because there are too many people around?
I have unmuted.
Yeah.
Hello.
Yeah.
Yeah, in this auspicious day, rather, Teachers' Day, that which is celebrated as, I really thank Dr. Chakravarti, who has allowed me a 1 decade back. So to join his team, and who, with him, yes, we has definitely moved ahead, and we have really innovated many things, but still we need to shape our haploidentical transplantation in the field of in particular cases like non-malignant cases, which we are doing in our research lab. So once again, I thank Dr. Chakravarti, and I'm saluting him to being my teacher.
Thank you. Yes, so that's Dr. Sarita Jaiswal, who is possibly the most dedicated doctor I've seen in my lifetime, apart from Pankaj. And if we have achieved the success we have today, it's simply because of her. I mean, myself singularly, I can impart some, bad or good wisdom, but to execute and to carry it forward, you have to have someone. And she has done it brilliantly, along with all the research that we have conducted. So thank you, Sarita, for being there. And I always maintain that the best teachers for a doctor are the patients, and I maintain it very strongly. But apart from that, I think I've learned a lot from Dr. Sarita as well, in the matter of how to conduct yourself. And there are many times that where I have slipped in terms of practice, where I have made a wrong decision. She was there to correct me.